Let's talk a bit about why the strike is happening, shall we, and what might end it at some point. We're joined now on the sofa by Dr. Emma Runswick, who's from the British Medical Association. Thanks for coming in, Emma. I think some of our viewers will hear the warnings about how disruptive the strike's going to be over the next 4 days, and will be really worried about how they're going to cope and what the knock-ons might be for them and their families. What do you say to people who just think this isn't right to strike in this way and for this long?
I'm always really sorry to hear stories about disruption, but the key message really is that this strike was entirely avoidable and preventable. We have been asking Steve Barclay to put forward a credible offer for months and months and months. We even offered last week to suspend action, even at short notice, if the Health Secretary was willing to put a credible offer on the table, and he has declined to do so. We've had no offer whatsoever. We're not included in the wider NHS offer. We've had absolutely nothing but more and more preconditions. At the last set of industrial action, we maintained safe care, urgent, critical, maternity care, all maintained. We had regular meetings with NHS England. I'm fairly confident that safety can be maintained through strike action by junior doctors, but it does cause disruption. It's not something any of us want. What we want is pay restoration so that we can reverse our workforce crisis and get back to giving patients the care that they really deserve.
OK, you say that he needs to come up with a credible offer. He says you need to come down from your demand of 35%. I mean, the ball is in your court as well here, isn't it?
It's really not. We've been asking
35%?
We've been asking since last August for a reversal of the real terms pay cuts that we've suffered since 2008. So we've lost 26.1% since 2008. If you take £25 away from 100, that's £75. To get £25 back, that's a third of £25. So we're only asking for a reversal of pay cuts. We've had that position
only?
for
35% is not really only, is it?
We've had that position for a long time. Steve Barclay refused to discuss with us. We're happy to negotiate. This is not a situation where we are, damn fixed in our position. We are looking for negotiations, and Steve Barclay isn't willing to even talk to us.
But so you haven't, though, said we'll come down to 25% from 35% or something. That's, I think, the kind of thing that he might want to hear.
Yeah, but we're not negotiating on, live television or in the media.
But even to him.
Yeah, but he hasn't put any offer at all on the table, not a counter offer at all. So if we want to start a negotiation, there has to be two sides in the discussion, and we are the only side in the discussion at the moment.
What would you say to those people who today might be expecting emergency treatment and not get it, or have to wait a very, very long time for it, or for somebody who's had an operation that they need desperately cancelled?
So there'll be lots of people in that situation who are having operations cancelled this week, and most of them, it won't be the first time that they've had operations cancelled, because the NHS is already in such trouble all of the time. Why is it in such trouble all of the time? Because we're understaffed. Why are we understaffed? Because we're hemorrhaging our staff to Australia, New Zealand. We've seen this week the Times headline, record migration to the Antipodes, to Australia and New Zealand, driven by British doctors and nurses. The reason that we can't provide good care at the moment, timely care at the moment, is because of a series of decisions over more than a decade that have driven down pay and conditions and driven out staff. We want to reverse that. We'd like people to receive the care that they deserve. All of us are in this profession to give patients the care that they deserve. We know it's not happening right now. We need to get into negotiations so that we can change that.
Do you see, though, for a patient, how this might be very, very frustrating? Because you have your line, Steve Barclay has his line. Someone somewhere's got to give.
Absolutely. And I mean, we're happy to be in negotiations. We've never set any preconditions for negotiations.
What would it take from him? What do you need to hear from him?
A credible offer. And we wrote to him last week very clearly setting that out. He needs to make a credible offer. We would be in negotiations yesterday, last week, this week, during industrial action, before industrial action. We've been writing to him since August. So there's no difficulty on our side entering into negotiations. It's the preconditions that on Steve Barclay's side that are preventing that from happening.
But he's kind of saying the same thing the other way around, isn't he? He's saying, we're happy to talk, but they've got to come down from their 35%. And meanwhile, patients we've heard this morning who said that they were in tears when they heard that they had an operation cancelled, just really, really frustrated. Can you not both sides just at least get in the room together?
So we're not the side with the power here to start negotiations. We've been asking for literally months before we even balloted for industrial action. We then warned in January when we started balloting for industrial action. At any point, Steve Barclay could have entered negotiations with us. When we met after the last round of industrial action, he literally walked out of the room having put nothing on the table. So, people might try and say, both sides need to move here, but we've done everything that we possibly can do. It's his choice not to talk to us.
Some patients will be upset by the timing of this particular strike because it comes right off the back of the Easter holiday, deliberately, I'm sure, when a lot of staff are off anyway and it's the school holidays, and it will lead to even more disruption that would have been in a normal week. Can you understand their anger?
Yeah, absolutely. We had the last round of industrial action. We didn't call any further industrial action. We waited for the negotiations, despite Steve Barclay messing us around, calling for meetings, then rearranging them. We had the first meeting on that Wednesday. We got nothing. The following day, we called further industrial action, and it just so happens that 2 weeks' notice is now. So we've called it at the earliest point, essentially.
You didn't have to do it this week, did you?
No, but there's a question about how do you keep up momentum when you've got a limited timeline in which to call action. The trade union laws dictate that you only have 6 months. So we have to move. If we're going to move Steve Barclay from this position of, we're not even going to talk, we're in a really difficult situation.
So in practical terms then, how long can you keep this going?
Well, we aim for this to be the last round of industrial action. There's, none of us want to be on strike here. This is not the position where we're looking to take industrial action for the purpose of taking industrial action. We're looking for the government to move, but we will continue. Our mandate is incredibly strong. 98% of junior doctor members voted for industrial action. So we have to keep taking action until we can reverse the pay cuts, reverse the workforce trends that are really damaging our service, damaging our care to patients, and fix the situation in the NHS where we've got 7.2 million people on waiting lists, people waiting in corridors in A&E, moving across the country for mental health care. We know that that's not acceptable. We'd like it to be better, and we think it can be better. We think the public in this country deserve better.
Okay, Dr. Emma Runswick from the BMA on behalf of the striking junior doctors, thank you very much indeed for coming.
Thank you.
Thank you. Now, if you've been